Hello everyone and welcome to Medical Channel Asia. Today we'll be talking about a very special and very common men's health topic. And today I also am joined with Dr. Niti, a consultant urologist who deals with this kind of problems much more often than we care to admit. So Dr. Niti, do you want to introduce yourself?
Hi, I am Dr. Niti Navanimitkul. I am a urologist at the Bangkok Hospital Pattaya. I had the experience for over 15 years. I was expertise in the penile implant surgery, sexual dysfunction, andrology, and the prostate disease. I will provide the advanced, innovative, and the specialized care for my patients.
So lots of people have heard about prostate cancer, but BPH or benign prostatic hyperplasia is something different, right? So how would you explain that to someone who doesn't know what BPH is?
The BPH stands for the benign prostatic hyperplasia. It's a non-cancerous enlargement of the prostate gland. The prostate gland is hiding in the pelvis below the bladder. Anyway, the prevalence of the BPH we found in the men who over 50 years old, we found 50% of the case, and more than 80 years old, more than 80%, we found the prevalence of the BPH.
So it sounds like it's just an enlargement of the prostate and it's not cancer, so why is that a problem?
The patients will have the symptoms like urine flow was not good enough. Maybe you have the urgency, or maybe you're feeling that you could not empty the bladder after the urinating. Or the patients maybe wake up many times in the night to the urinations.
So you also mentioned that BPH happens more in elderly patients. So what exactly causes BPH?
We do believe that we didn't fully understood what is the cause of the BPH, but we have many factors that should be the cause of the BPH. The first one is the aging process. Then when you get older, the prostate is get bigger. The second one is about the genetic. If you have the family history of the prostate cancer, you're prone to be the prostate enlargement. And the last one, we do believe that is because of the dihydrotestosterone hormone that can affect to make the prostate cell is get bigger or enlargement of the prostate gland.
So it sounds like BPH is something inevitable that will happen to anyone who is older, and the symptoms don't sound so bad, like they sound annoying but they don't sound life-threatening. So is there any reason that you should treat?
Yeah, you're not right. The BPH can make you have the many complications. The first that can make you have the urinary retentions. It means you could not urinate, and maybe sometimes we have to put the tube to drain the urine out for you. The second, maybe it can cause of the urine infections or even the stone formation. The third, maybe it can make you have the kidney damage because of the blood pressure to the kidney. And the last one, maybe it can cause the permanent bladder damage that can make you need the catheterization in the long term.
So I think many men are really embarrassed about this topic. They might find it a little bit hard to talk to a doctor about something like that. So maybe you can share with our audience a little bit about what happens when they go and find you for a problem like BPH.
Okay. When you come to the doctor office, we will ask you about your symptoms. Then we have to check about the digital rectal examination. It's a simple test for the urine test, the ultrasonography, or we can test about the uroflowmetry. And the last one options, we have to do the flexible cystoscopy if we need more information. And every test we can do in the office is not too much scary.
So after all the clinical diagnosis that goes on in the office, now you know that you have BPH. What are some of the treatment options you may offer to your patients?
The treatment option is up to the severity of the BPH symptom. If you have the mild symptoms, maybe we have to start with the lifestyle modifications. We have to avoid the coffee, caffeine, alcohol, or even you have to drink less water after 6 p.m. Anyway, we have the medication to treat the BPH. The first medication we talk about the alpha blocker is for relax the prostate muscles, make you can easier to pee. The second one we talk about we call the 5-alpha reductase inhibitor. It's the medication for shrink the prostate, but it takes time maybe 6 months to shrink maybe 20% of the prostate tissue. And the last one we talk about the anti-muscarinic is for treat the bladder functions. If you have the urgency or you have the inconvenience, maybe that medication will help you.
So you mentioned that it's for moderate cases, right? You can use medication, you may even just wait. But what if it's something more severe? What would you do then?
In the severe case, we have to do the prostate surgery. The gold standard one is the TURP, the transurethral resection of the prostate, that we have to cut the prostate tissue and shape the prostate to make the lumen of the prostate is get wider. Another options we have to talk about the HoLEP is the holmium laser enucleation of the prostate. It's a one type of the prostate surgery.
That all sounds very scary. You have to cut it, you have to burn it off. But is there anything else, maybe less invasive?
Yes, you're right. We have another one is the less invasive, or we call the minimal invasive surgery. Then the minimal invasive surgery that we are available right now is the water vapor therapy, or we have the PUL, is the prostatic urethral lift that we have to talk today.
Prostatic urethral lift sounds interesting. Maybe you want to share a little bit more?
The PUL is the prostatic urethral lift, is the minimal invasive surgery, and we don't have to cutting or heating or do the surgery on the prostate.
So how does PUL work then?
The PUL we do under the local anesthesia or the IV sedations. We have to do the transurethral by the endoscopy. We use the small clips to lift up the prostate gland to hold the prostate, that we can widening the prostatic channel to this obstruction of the prostate.
So you mentioned that PUL, there is no cutting, there's no burning, there's just lifting. Many people might wonder, does it really work? Is it really effective?
Yeah, I think the PUL we use for the small to the medium size of the prostate. Then from the clinical study, it showed that it's proved they have the durability for over 5 years, and it's very safe and effective for the BPH patients.
And you mentioned that there were quite a number of different procedures, right? So what makes PUL stand out over the others?
You will know that the PUL we don't have to cut, or we don't have to use the heating. Anyway, the PUL is have very quick response. We can do in the office base, and we can preserve the sexual functions by the PUL.
That's important.
That's very important thing for the men.
So when would you recommend PUL to your patients? There must be quite a few who come to you for their BPH symptoms.
The PUL it should be worked for the patients who have to on medications but don't want to take the medication in the lifelong, or even you have the side effect from the medications. It's good for the patients who are the candidate for the prostate surgery, but they worry about the complication of the surgery. Even in the patients who have the high risk for the anesthesia, that the PUL is work for this group. In the people who have the medium to large prostate gland, another options may be the suitable instead.
Yeah, so PUL sounds like a really promising treatment option. How has the feedback been so far?
The past year I done the PUL for over 70 cases, and the patients mostly is happy. They quick response after the PUL, quick to normal activities, preserve the sexual functions, and no catheter after the PUL. When they come to follow in my office, they come with a smile because they are happy.
So before we wrap up this whole conversation, I think you've seen a lot of men walk through your doors with BPH. You must have seen so many and treated so many of them. What would your main advice be for all these men out there?
I think the BPH is the simple problem, and every man have that. I see many cases, seen many the BPH patients, and in the case who have to on prostate medications, you will know that we have another option. Is the alternative with the medications, and it's work very well. If you don't want to take the medication in the lifelong, please come to talk with us, the urologist. We will provide the option is available and suitable for you.
Thank you so much, Dr. Niti, for joining us today and sharing all your insights with us. So I think this is a really important episode for everyone, because all of us know some men in our lives who may or may not be experiencing symptoms of BPH. If this episode reminds you of someone you love, please share this with them so that they will know that there are options available for them. As Dr. Niti says, you don't have to suffer alone. You don't have to suffer with the symptoms. There are many treatment options available. So thank you once again, Dr. Niti. Thank you
Thank you very much. Thank you.